a colleague of many of us have been here at St. Francis for a while. Actually, I've known Dr. Silverstein since I was a medical student, and he came and gave some talks to us in our first and second year at UConn back in the early 80s. So many of you probably don't know Bob because he is a busy cardiologist in private practice, but is a prolific uh, writer. I don't know if there's anybody I know who's had more letters to the editor, comments in various journals, well into the present day on in the areas of his particular interest, was had to do with preventative cardiology. Dr. Silverstein went to medical school at the Ohio State University and did his residency there, and then went to Atlanta, to Emory, and worked under Professor Hurst, who many people know from the textbook that is a standard in the cardiology field. And then was in the Air Force, I believe, and found his way to Connecticut and has been practicing and teaching here for certainly over 40 years. So I'm delighted that Bob agreed to do a talk today in cardiology on his favorite topic. And with that, I'll turn it over to you, Dr. Silverstein.
Okay, good morning, everybody. Um, as you can see, the title of this talk is A Live It, Not a Diet, and you can see that it'll largely be focused on nutrition, and we'll get to that in a while. But actually, I wrote an article that was published in the European literature, excuse me, called The Unhappening of Heart Disease. Find most of what I say today in that article online. Now, just to get everybody in the right mood, a little bit of happiness here.
We still don't hear it.
You didn't hear it? Okay,
Didn't
well, that's
didn't
uh,
hear the Zippity Doo song. I'm
okay. Well, that's a tragedy because one of the rules that I was told was to sing a happy song every day to get yourself into the right mood. So that was my attempt at that. Sorry, it failed. Now let's move on. Now, the concept is the prevention of disease. And while I talked about the title, The Unhappening of Heart Disease, it's actually the simultaneous prevention of multiple diseases. And the ideas may be a bit foreign to you. So, once again, I have to flatter the audience and say to you that I'm sure you are all unusually supple minds capable of seeing beyond parochial concerns. I like the wording of that. I was an English major and undergraduate. So the literary ring of that sentence caught my attention. And some of the ideas will be more than a bit different from what you're used to hearing. So I ask you to just relax and suspend disbelief. Finally, all of this is an invitation to consider. None of it is demand or command. My point of view, accept it or don't accept it as you see fit. Cesare Beccaria was a 1700s Italian philosopher who said it is more efficient to prevent crime than to punish them. And I reworded that into it is more efficient to prevent disease than to treat and pay for them. So I'm going to present the idea of how not only to help patients, but how to reduce healthcare costs. Tom Lee of Harvard said that healthcare, this is a quote of his, healthcare costs are the pounding headache to which each of us will awaken every day for the rest of our life. And so this is about health and healthcare cost reduction. Now, why do I have this character here? Well, that's how well received some of these ideas have been in the past, and some people may think that's my portrait. But regardless, we'll play a little bit of trivia for a second. What international flag has three stripes of red, yellow, and blue, and nothing else? Now, I'll tell you in a second, but take a time to think about it. Romania. Next question is, this character is from Indonesia. How many islands does Indonesia have? Take a second. 17,500. Finally, last trivia question. How many islands does Hawaii have? 187. All right, going on. This is the most important slide in the whole presentation because it introduces the concept of risk regression to zero that we're going to talk about many, many times. This is not what you're used to hearing, so let me tell you what's here. If you give a sugar load to a patient or a group of patients and measure their sugar out here at 2 hours, if that value returns 155 at 1 hour or 83 at 2 hours, as on this slide, there is no future risk for the development of cardiovascular disease as far as glucose goes, as far as sugar goes. But what if it comes back 90 or 126 or 180? Frankly, I'm not interested in any of those numbers. I'm only interested in 83 at 2 hours. This is not perfectionism. This is disease prevention. Oops. Now, I like this slide just because it's pretty, and it shows what we don't know and what we do know. This is how I see diseases occurring. In fact, I think it's a true statement. First principles simplicity. That was said by a world famous physician. Most diseases occur if and only if the person with a genetic tendency does what is necessary to express that genetic tendency. So my position is nearly all diseases are genetic and merely represent the interaction of that person's genetic tendency coming in contact with specific and disease-generating behaviors, very much like separated lit match, and gasoline is no problem, but bring them together, that's when you have a fire or explosion on your hand. The head of the National Institutes of Health, former head, Francis Collins, is the one who gave this pithy version of what I just said. Genes load the gun, and then what the patient does is what pulls the trigger and generates the diseases. Genes load the gun, lifestyle pulls the trigger. And here is the preventable, if not curable, concept. 95% of atherosclerosis, diabetes, high blood pressure, high cholesterol, and high triglycerides are preventable, if not curable. And why? The answer is what I just said. Genes interacting with choices by the patient result in made to happen diseases. As you recall, the title of this presentation is The Unhappening of Heart Disease. So how to stop diseases before they can't be stopped. Finally, has to be carefully presented. By the way, I have presented this presentation to many patients in the office. Obviously, I bring it to a level of their understanding. It wasn't done to you, it was done by you. And no patient has barked at this presentation. And what is it the patients do? What is it the population does that results in our common disorders? 5 basic errors: breathing, drinking, eating, exercise, and unrealistic expectation. Breathing, smoke, dust, and fumes. Alcohol, 1 drink a day is shown to increase the incidence of cancer. It may reduce the incidence of heart disease. By the way, heart disease is responsible for 34% of deaths and cancer 22% of deaths. But 4 per week is my guess of what is probably the safe amount of alcohol intake if you can drink alcohol. There's now a big love affair going on with coffee, and some people believe that you ought to drink as much coffee as you can get in during the day. My position is 1 to 2 cups a day is probably what I'll call the quote legal quote limit. Then what should we be eating? And we'll get into this a little bit more as time goes on. Grains, vegetables, beans, fruit, nuts, and seeds at about the 90% level. Exercise, what is the goal of exercise? Abdominal clear lines of definition and demarcation, and I'll literally show you pictures of that. Here's an old saw, an old aphorism. You can never be too rich, have too many black shoes, or be too thin. Of course, that's not 100% position, as nothing is really 100% position, but it is essentially a true statement. Finally, if you want to prevent anxiety and depression largely, avoid unrealistic expectations. Life is difficult and unpleasant at times. Deal with it as best possible with humility. So do not be unrealistic. Now, this is epidemiology of cancer of the colon. And what this shows is that in Australia, New Zealand, Northern Europe, North America, there was a high incidence of cancer of the colon. And down here in Western Africa and South Central Asia, a very low incidence of cancer of the colon based on the differences of what these populations do. And similarly, there is an epidemiology for high cholesterol and atherosclerotic disease. The 7-country study was begun in 1958, the year after I graduated high school. So Japan and parts of Yugoslavia had very low cholesterol. As you can see, there is a gradation as you go up, which is here's your average American at the time of the 7-country study. That's now improved. But Finland had the highest incidence of high cholesterol based on their diet. Now, these indigenous people here demonstrate that concept that I was talking to you about, abdominal clear lines of definition. Here are Western versions of that showing that it can be done in our culture. But these people have total cholesterol of 90 to 130. And the famous Framingham study, which was begun in 1948, basically said that coronary artery disease essentially, not absolutely, essentially ceases when the total cholesterol is 150. I'll have more to say about that in a minute. These people have none of our diabetes, high blood pressure, high cholesterol, high triglycerides, cancer of the breast, uterus, colon, prostate, diverticulitis, etc., because they have not yet the technology to hurt themselves the way we have and generate the diseases. My first discussion of this was in 1990 when I published in Lancet a letter to the editor describing what I just told you. It was repeated in an invited article that I published in the American Journal of Cardiology in 2003. The concept is the abolition of symptomatic coronary artery disease. That abolition concept is not mine alone. There are other people who've written about it, and this is just a single example. Now, here are those pre-technological populations, hunter-gatherers, and they all have a total cholesterol of around 90 to 130. Wild mammals, wild primates, essentially the same. And then here's your American who had a cholesterol at the time the slide was originally made of around 225, which was average for myocardial infarction, and that number is now down to 200. Now, in the walking well, as you reduce the cholesterol level, this talks about LDL, but I prefer non-HDL cholesterol. So a non-HDL cholesterol of 90 reverses risk to essentially zero. In patients who've had ischemic disease, that number is about 75. Neither one of these are 100%, but they are essentially effective for population control. This is the famous Pac-Man AMI study that was done this year. And what this showed was by oculocoherence tomography, which is better than intravascular ultrasound, and near infrared spectroscopy, and then intravascular ultrasound, and standard coronary artery, coronary angiograms, that as you lower the cholesterol, you begin to reduce plaque volume and plaque cholesterol content. A 1% reduction in plaque volume and cholesterol content results in a 20% reduction in major adverse coronary artery events. Here's a doctor who doesn't quite get it. Not everything is due to high cholesterol. There are other chief complaints. Now, this is just a legible, hopefully a legible list of the items that need to be controlled in order to have prevention of largely coronary artery disease, but also stroke and also diabetes and also cancers in general. So the next slide will give you the exact numbers, but those exact numbers are listed at this website down here. The way to get to that website, it says www.thepmc.org, or simply put my name in Google. You'll find a link and it'll take you directly, the name being H. Robert Silverstein. Put that in Google and it'll give you the link, and the link will take you to that website. Non-HDL cholesterol of 90 or less in the walking well, and as I already said, 75 or less in those with coronary artery disease. Now, there are big studies that show that maybe we need to get the non-HDL cholesterol down to around 40 in order to significantly extirpate atherosclerotic disease. But the numbers of people in that level are very few. So basically, I'm giving population statistics. So non-HDL cholesterol of 90 or less. Take the total cholesterol, subtract the good cholesterol, and that number needs to be 90 or less in the walking well. Triglycerides need to be 100. Now remember, I asked you to suspend disbelief and basically give me a break. These are not the numbers that you're ordinarily told. For instance, going back to cholesterol, you're told to reduce cholesterol by 50%. That's not the number where risk regresses to zero. Triglycerides of about 100, an A1C of about 4.4 up to age 44, and not above 6.2 at age 62. Between those two numbers, it is the age with a decimal point. So at age 53, 5.3 would be acceptable. Blood sugar, we already talked about that. I had a slide showing that if the blood sugar is 155 at 1 hour or 83 at 2 hours on challenge, that there is essentially no future risk for the development of coronary atherosclerotic cardiovascular disease as far as glucose alone goes. Now, inflammation is the new darling of cardiology. And so Paul Ridker from the Brigham popularized the concept of the value of looking at these inflammatory proteins. The main thing that he looked at or popularized was cardiac HSC reactive protein. And what value do I think is reasonable for that? 1.0 or less. Blood pressure, 110 to 115 over 60 to 70. Again, we're talking walking well. You take a patient who's had a stroke and is 78 years old, has rigid tubes, that blood pressure will likely be too low. Not absolutely, but likely. So for patients with fixed atherosclerosis already, I usually say 125 over 80, 70 to 80. 12% sodium refers to when you shop for foods that are already pre-prepared. If the sodium content in the serving you are going to eat, 12% or less. Cancer of the prostate blood test, PSA, 1.0. TSH, 3.5, not 5.5 as the lab says. Hemoglobin, 12 to 14. Not 15, not 16. That has to do with viscosity. Lipoprotein little a, about 7 or 8. Now that one is tough. There isn't really any good medication on the market that gets lipoprotein little a down. As everybody knows here, that now correlates with development of aortic stenosis in particular, but it also affects the risk for the future development of myocardial infarction and stroke. So the LP little a needs to be about 15. I have patients with several hundred. With some of the new medications coming out that are just around the corner, actually with the PCSK9 medications, commercial names Repatha and Praluent, alirocumab, evolocumab, those get it down about 25%. but getting an LP little a down from 325 on a patient I just saw yesterday, down 25% is not going to be a significant improvement. There are medications in development that get it down 90%. Homocysteine, if you have kidney disease, this is likely to be high, and it does correlate with an increased risk of stroke. Nobody is really quite sure if lowering the homocysteine with the vitamin B complexes actually reduces the incidence of stroke, but on the other hand, it definitely gets the homocysteine down. Uric acid, about 5.5, BUN, around 12 to 14, magnesium, which tells you an awful lot about people's diet, needs to be 4.1 or a little higher. Potassium needs to be, I said that wrong. Magnesium needs to be 2.1 or a little higher, and potassium needs to be 4.1 or a little higher. Joanne Manson of Harvard believes that the 25 D3 level ought to be close to 30. She was head of the Institute of Medicine's Vital Study, VITAL, and she and I have corresponded for years over this. I've said to her that I think the proper level is 50 to 66. By the way, I don't make these numbers up. I have either, they are in the literature. Almost everything I have said is somewhere in the literature. This study, this value is wrong. It's not 11 to 27%. Someday I'll change this. It's 11 to 20% is where abdominal clear lines of definition and demarcation occurs. Now, is 27% better than 43%? Absolutely. If you want patients to lose weight, if you're having a hard time getting them to be successful at that, have them keep a food diary and write down on paper everything they eat. That is one of the most helpful things I can tell you about helping patients lose weight. Keep a paper written food diary. What should the diet be? Well, this starts it. Grains, vegetables, beans, fruit, nuts, and seeds. The food mantra is eat foods exactly as they grow up out of the ground and in the field. Overweight, you want to help people eat mostly cooked vegetables, excluding potatoes. The best foods for losing weight are eaten out of a bowl. My healthiest patients are, in fact, vegan. Aerobic interval training, any kind of exercise will do. Obviously, quit smoking. There is a supplement on the market. It's available in Europe, but you can get it online. Cytosine, Cytisine, has been shown repeatedly to help people stop smoking. We already talked about alcohol, 4 per week or less. Reality, we talked about that. I recommend the Omron wrist blood pressure cuff, not the arm. And in general, avoid wheat, dairy, and soy. Okay. Now, this is what the online paper actually looks. It actually looks like. And on the website, it's a little hard to, it's impossible to read here, but this has the values and you'll find them online, everything I just said. Now, atherosclerosis begins in childhood. If there were studies done during the Korean War and during the Vietnam War, in which they looked at the hearts of those soldiers who had been killed, and they found a definite incidence of atherosclerosis, which begins, as I show you over here, even at ages 6 to 18. The heavier the child is, the higher their level of insulin, glucose, blood pressure, and triglycerides. So even at age 6 to 18, we're already developing those risk factors based on percent body fat for the development of atherosclerotic disease. And here's what percent body fat does to high blood pressure, diabetes, cholesterol, and triglycerides. As the percent body fat increases, so does the cholesterol, risk of diabetes, and hypertension. The risk is direct, continuous, and linear. Now, this is an interesting slide because it shows even if you've done things wrong and have a high cholesterol, very few people will have any atherosclerotic event at around age 40. Now, That's not an impossibility. The youngest patient that I ever took care of with myocardial infarction had familial hypercholesterolemia. She literally died at the age of 17 after her third myocardial infarction. But in general, on a population basis, when the LDL is down around 50, it was when the non-HDL cholesterol is around 90, but the person is overweight, there's still no risk. But the effect of overweight on cholesterol begins to show up the older we get. And the same thing, it begins to show up on triglycerides. And this is risk of cardiovascular disease as one ages. Now, this relates to the coronavirus and percent body fat. Here it talks about fat mass being 23%. Well, let's do the calculation. Total cholesterol 178, HDL cholesterol of 69. When you subtract 69 from 178, is that 90? And the answer is no, that is not 90. What you want is that percent body fat that gives a non-HDL cholesterol of 90 or less in order to reduce risk to zero. So, okay, so we'll take it for what it is. Here are the inflammatory cytokines based on percent body fat. Tumor necrosis factor, interleukin 6, interleukin 1A and B, cardiac HSC reactive protein, and a host of others. And as you can see, that these values go up as percent body fat goes up. That was one of the things that was found out during the coronavirus epidemic, that heavier people were more predisposed to serious adverse events than were people who were trim. Now, again, that was not a black and white 100% statement. It was a populationally true statement that the heavier the patient was, the greater their risk of developing severe coronavirus issues and mortality. This one's pretty obvious. And as you can see, by 2030, more than 50% of the nation is expected to be overweight and obese. And correlating with that is the increasing incidence of diabetes in the population. This is an excellent instrument, which, by the way, shows the proper percent body fat up here. You hold this in your hand, enter some data down here, and then it reads your percent body fat. I have one of these in the office, but I don't really use it, except rarely when somebody wants to debate, because we've already talked about what is the final arbiter. And the final arbiter is, are you at abdominal clear lines of definition and demarcation? You might say, what percentage of your patients have that? Small, but that's not the point. The point is that is, or what should be, the goal to get as close to as possible. And I published in the Journal of Clinical Hypertension in 2008 an article justifying the wrist blood pressure cuff. Omron is the most accurate of the wrist blood of blood pressure cuffs. Omron makes wrist and upper arm cuffs. I recommend wrist primarily because of the size of people's upper arms, and in addition, its portability. This blood pressure, by the way, is too high. If you recall, I said 110 to 115 over 60 to 70 for the walking well, and about 125 over 70 to 80 in the in people with hypertension or atherosclerotic disease. So yes, this is obvious. I see food and I eat it, so therefore I'm on a seafood diet. This is the mouth of a carnivore. Fangs and claws, sharp teeth all the way to the back, a jaw that comes down in a scissors action. On the other hand, chimpanzees, gorillas, you and I, we have 4 poorly developed teeth. I forgot one point. This animal can safely digest rotten meat. This group cannot. This is a jaw that comes down to grind, has an enzyme for digesting plant food, not protein, in the salivary gland. 4 out of 32 teeth for tearing meat gives you an option of animal protein at 1 out of 7 to 8 meals. Gladiators were massively muscular. Their main food was lentil barley soups. They ate animal protein 3 times a year the night before they went into the arena. The word burly, which means big and husky, which are what these guys are, comes from the word barley. Now, on the very first slide, I talked about a livet, and that is grains, vegetables, beans, fruit, nuts, and seeds. Grains being millet, brown rice, quinoa, teff, amaranth, hulled barley, oat, groats, and so on. Most barley in stores is pearl barley. 77% of farmland is used in the production for meat and milk. Look how much farming land could be reduced back to nature if we ate much less meat and milk products. And here is the concept: foods exactly as they grow up out of the ground and in the field. Grains, vegetables, beans, 7 or 8 to 1 ratio, which translates, if you're trim, animal protein as an option 5 times in 2 weeks. I'm not here to command anybody. All of this is an invitation to consider. So just listen to what I have to say and then make up your own mind. Hulled barley, I just discussed that, not pearl barley. Brown rice, not white rice. These are whole grains: millet, quinoa, teff, amaranth, oat groats as opposed to steel cut oats, and oatmeal. Certainly, oatmeal is better for you than sausage and bacon. And finally, we should be drinking green tea, eating fermented foods like sauerkraut. For those of you who know how to make miso soup, I recommend that. Um, at the natural food stores, you can find several varieties of sauerkrauts. In my refrigerator, I have fermented beets, seaweed, sea vegetables, and also regular cabbage sauerkraut. And then finally, sea vegetables are eaten by many cultures around the world that border the ocean. And to use a popular word, very detoxing. So here we begin to see what the food should actually look like. And here is more of what it looks like. Turns out that legumes, beans have plenty of protein. And as I already showed you, the gladiators were massively muscular on lentil barley soups. More of what the food should actually look like. Finally, this is the same tough love message as before. We have met the enemy and he is us. This is a poster from the first Earth Day, 1970. This little creature over here is Pogo. This poster was created by Walt Kelly. Now, I'm going to give you a little treat. And we're going to play, if I can find it. Let me know if you see that. This is a comrade.
The audio is not coming through.
Audio not coming through. Elena? Audio not coming through.
Yeah, I don't think he's unmuted.
See anything? Is it coming through now?
Nope.
All right,
It
hang on.
It might be on his end.
Say again.
Maybe it is on his end. He maybe needs to unmute himself.
No, this is a video that I have on my desktop.
It's not working just like the prior Zippity Doodah video, unfortunately.
All right, then maybe we can get Bill, open up your microphone if you're online and deliver your little discussion. Are you there?
He's still muted. Let me see if I can unmute him. Yeah.
Can you hear me?
Yes, I heard that.
Okay. So if you go back to the video, below the picture on the far left is the speaker. It is crossed out. That means it's muted. If you click it, it will unmute it.
Well, why don't you just deliver your thoughts?
I can do that too. Well, in 1977, that's almost 50 years ago, I was working at the Center for Living with Illness and Dying in New Haven, Yale. It was my experience then that a few of the patients that I was counseling who presented with life-threatening illness like advanced stage cancers radically changed their diets and lifestyle and reversed their conditions and saw their cancers go into remission. Whether or not that was a result of diet alone, lifestyle changes, or concurrent mainstream treatments, I was convinced on whatever was going on, the diet played a significant role in the development of cancer, especially lung, colon, and prostate cancers. So I had easy access to the dean of the Yale School of Medicine, Robert Berliner, who many of you probably know affectionately as the dean of renal physiology. Before that, Bob Berliner was deputy director of science at NIH. And I proposed to the dean that there was a relationship between diet and cancer. He kind of laughed and replied that maybe nitrates and hot dogs, but little else, and then kind of scolded me and said cancer is very complex. I pushed my hypothesis further, and I suggested that maybe saturated fats, especially from dairy food, maybe the simple sugars that were out there, substitutes, even possibly a lack of fiber that comes naturally from whole grains and vegetables might be implicated. But he laughed, and this time he did grant me the possibility that there might be something wrong with saccharin. But he did say dairy food and sugar didn't cause cancer. And he told me his research funds was going to be used for studying nuclear medicine, trials of chemotherapeutic agents, and radiation, but not food. And with that, he made it clear the meeting was over. Strangely, in 1982, only 5 years later, the National Research Council Committee on Diet, Nutrition, and Cancer, which was a division of the National Academy of Sciences, published a landmark study and concluded, we emphasize the importance of including fruits, grains, vegetables, and whole grain cereal, especially in the daily diet, because in epidemiological studies, and this is quoted, frequent consumption of these foods has been inversely correlated with the incidences of various diseases, especially cancers. Among the 10 members of the committees were two names you might know. One is Colin Campbell, MD, whose exhaustive research is popularly known as the China study, who examined the link between the consumption of animal products, including dairy, and chronic illnesses like coronary heart disease, diabetes, breast cancer, prostate cancer, and cancer of the bowel. Campbell's 20-year study looked at mortality rates from cancer and other chronic diseases from 73 to 75 in 65 countries, counties rather, in China, and correlated this data with 1983-84 dietary surveys and blood work from 100 people in each of those counties. And Dr. Campbell concluded that people who eat a predominantly whole food diet, avoiding animal products as their primary source of nutrition, including beef, pork, poultry, fish, eggs, cheese, milk, and reducing their intake of processed foods and refined carbohydrates, could escape, reduce, or even reverse the development of numerous diseases. He then went on and criticizes in the China study low-carb diets, which include restrictions on the percentage of calories derived from carbs. Campbell was critical of reductionist approaches to the study of nutrition, where certain nutrients alone are blamed for disease, as opposed to studying patterns of nutrition and interactions between all the nutrients. And incidentally, the other member of the study, the committee who released that report, was Robert Berliner, who shortly before his death 20 years ago, I saw at a family gathering in New Haven, at which time, when we shook hands again, he smiled and said to me, "You were right." Fast forward, hundreds of research projects and papers published since confirming specifically and in more detail lots of advice and recommendations and findings like that, which you've just seen from Dr. Silverstein, and 3 years ago from the American College of Cardiology and the American Heart Association, where the guidelines on nutrition said, quote, "A diet emphasizing intake of vegetables, fruits, legumes, nuts, whole grains, and fish is recommended to decrease atherosclerotic cardiovascular disease. Replacing saturated fats from dairy foods with good oils like extra virgin olive oil, coupled with reduction in amounts of sodium, processed meats, refined carbs, and sweetened beverages can be beneficial to reduce ASCVD risk." So despite multiple dietary practices that have demonstrated improved health outcomes, the specific foods that are responsible for these are still partially unknown, yet we have some hints of the foods that are the most beneficial simply by looking at what's popular now, the Mediterranean diet. The macrobiotic diet, which I've followed for 50 years, I'm 75, always emphasized whole cereal grains like brown rice, millet, oats, buckwheat, corn, and others, and a variety of local seasonal vegetables, particularly leafy greens rich in calcium, like kale, collards, broccoli, mustard greens, cabbage, Brussels sprouts, and ground, and root vegetables, which are rich in beta carotenes, like carrots and squash, beans and legumes like chickpeas, lentils, and others. And of interest, one of the findings of the related research is the higher concentration of glutamic acid in plant proteins compared to animal proteins, something we know which has been linked to lower blood pressures. And even seeds and nuts, which have a high L-arginine content, which is converted to nitric oxide, may play a positive role in CV health. Absent from the Mediterranean diet, however, are three things which I always recommend, which Dr. Silverstein has now spoken about. Sea vegetables like kombu, wakame, nori, and other greens rich in calcium and iron, and many other trace minerals are incredibly important in a daily or weekly diet. They've been consumed by cultures for centuries, particularly Asian people, but varieties of them are plentiful in coastline countries like Ireland, Spain, Italy, and along the Adriatic. And oddly, when rarely mentioned when people discuss the Mediterranean diet, sea vegetables are important, but not just for coastal people, as you just heard, but traditionally we learned that Middle Eastern, Middle Western in the United States, cultures of Native American people would go to coastal regions and trade various foods that they were growing for sea vegetables that were on those coasts. Second thing that is recommended, which are the fermented foods, which Dr. Silverstein also said, we now see are huge important for our gut microbiome, where among other things, 90% of our serotonin is produced. Brain mind, body mind, amazing if we want to go back to that sing a happy song conversation. Plant-based fermented foods like miso, tempeh, sauerkraut, kimchi, kombucha tea, and even the simple pickles that you can find in most places should be consumed nearly every day. And thirdly, not part of the Mediterranean diet, but something which has a lot of research now, which many know, dozens of studies found highly regarded as supporting in cognition, maintenance of moderate weight, and other protections against cancer is green tea. So in study after study, diets with higher adherence to plant foods are now being associated with improved cardiac morbidity and mortality in the general population. This remains the case regardless of adjustments for sex, age, and socioeconomic status, among other factors. So the question remains not only about what we might recommend to patients, but even more what diets and lifestyle practices we as physicians and healthcare providers have adopted in our own day. So day to day, what are you eating? What am I eating? What are our doctors eating? This is one reason why, among many, that I have such a high regard for Dr. Silverstein. I had the very good fortune to meet at basically the same time I met Dr. Berliner. This is a rare physician who walks his talk, and I hope you can continue to learn from his example and exhaustive study and publications, practices that I have been fortunate to do. I appreciate the opportunity. Thanks, Bob.
Thanks, Bill. I would like to say that Willis Hurst and Bill Spear are two of the most important people in my cardiac education on a daily basis. I use more of what Bill Spear taught me than what Willis Hurst taught me. But on the other hand, we've worked together for many years and we see things similarly. All right, so let's open it up to questions to either Bill or myself.
So let me just say to the online audience, you can unmute yourself if you like, or put the question in chat, and I'll keep an eye on the chat and type in if there are some chat questions. Well, maybe I'll begin, gentlemen. First of all, Dr. Spear, thank you for joining us.
Thank you.
And Bob, as usual, a very provocative talk. Seems to me that when we have this very distorted culture in some ways, where I almost wonder if all the research going into looking for the magic ingredients in these diets will end up in a pill that can be promoted rather than what you all are articulating, which really has to do with making consistent, meaningful changes in your lifestyle and in a way going at it from the macro perspective. So eating differently, exercising differently, rather than sort of looking for the medication that's going to do the trick. I think we've seen that with, I used to refer to them as the cholesterol mafia, that we're pushing medications as the only solution to try to lower cholesterol. But I think you've made it a pretty cogent argument that you can do this without sweating the small stuff in a way. But I kind of wonder if given how medicine is going and the role of big pharma in our lives, is this something that you worry about?
What you literally hinted at is a medication, a supplement that's available over the counter. On TV, there's this product called Balance of Nature, which sort of presents itself as exactly what you're saying. And I would say this, whatever it takes, you cannot argue with basic biology. I gave you the 5 basic requirements: what we breathe, what we drink, what we eat, what we exercise, and what we allow ourselves to think. And those are non-negotiable. Those are the human biology. The closer you get to them, the better off you are. For instance, if you ate Balance of Nature and you found that it kicked up your energy and you exercise more, that's a plus. Or you found out that it helped you avoid the sausage and the bacon, that's a plus. So I'll take that. But ultimately, it is as simple as possible. Eat foods exactly as they grow up out of the ground and in the field, and ideally organic. Organic is, of course, always a best guess, but I think it is a best guess. So I would say that the rules are clear: breathe clean air, drink essentially clean water, weak herbal teas, kombucha, exercise to the point of abdominal clear lines of definition and demarcation. Don't be rigid about anything. Eat a grain, vegetable, bean, fruit, nut, and seed diet as best you can, and a little bit of humility and perseverance. Those are not my rules. Those are the biologic requirements for the human body. So get as close to that as you can. You are right. Somebody's going to try to commercialize this. Certainly the statins and the PCSK9s all have an important role. But as I implied, this could be reversed with proper behavior, decisions, actions, and so on.
If I may comment on your question as well. Bob and I have had conversations about probably the most difficult thing of all, which is how we change behavior. And that last piece is really what it's all about. It's like people look at the way in which we're eating, and probably the first thing they think of when they leave the office is how am I going to find these foods, or how am I going to cook these foods? And then not long after that, they'll think, what's it going to taste like? So they have this kind of sense that we're holding our nose and eating food that tastes like clay. I have behind me 120 cookbooks, any one of which would be fantastic for the whole dietary recommendations that were just shared. 30 of them are on desserts alone. None of those desserts have white sugar or any refined sugars in them. We eat like kings. We eat fantastically delicious, wonderful foods, including desserts, and enjoy them. The last thing I want to say is that there is something that a pill, and you limited your expression of the mafia to cholesterol. Well, there's a lot of other mafias coming out of pharma that are trying to do whatever they can, not just the cholesterol mafia, which is big pharma's job to make money and try to figure it out. And more power to them for when they're really treating successfully and reducing risk factors. But the one thing that a pill will never do, and that whole grains do brilliantly, but requires people's engagement, is chewing. So it was very fast that we saw that one slide about the teeth and the 7-to-1 ratios of grains and vegetables, beans, seeds, and nuts to animal foods, and the grinding aspect of molar, Latin for to grind, that grains are. When Bob said something about the saliva, but what he didn't say, and most people probably forgot, is that what's secreted in the saliva is ptyalin. That enzyme is responsible solely for breaking down complex carbohydrates and whole grains into the simple sugars that give us the energy we need. You're not going to chew a pill. And the actual act of chewing, not just the grinding and the secretion of ptyalin in the saliva, but the act of chewing, the movement of the whole jaw and mandibular joint, all of that is a powerful energetic stimulus to digestion and to overall health, to better circulation, to blood pressure, all kinds of things that the Chinese have known for a long time, and they put into practices like Qigong and Tai Chi. So as many pills or injections as we want to take, you stop people from chewing. Even if you give them hyperalimentation, you might save their lives for a while, but you're not going to necessarily improve them. So chewing while you're singing a happy song, chew, 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 100 bites or chews per mouthful, or 50 or 25. Watch someone eat animal food, and you'll see 3 chews, 5 chews, 8 chews go down the hatch, boom, into the stomach. Here comes the acid, and down the slope we go. Watch people eat grains and vegetables, and you must chew in order to get it into that chyme to squirt through the pyloric sphincter and get it into the digestive tract in a way that can be utilized. Very different. That doesn't happen with a pill, no matter how sophisticated the supplement is that we might make.
It's funny you should mention chewing. I had a conversation in my office the other day with a colleague because I was discussing a patient who came in who may be an adult with undiagnosed ADHD. And he said that after he gave up chewing tobacco, his memory and he got more scattered. His wife was in the room, said the same thing. And so I was talking with my colleague, and she said there's literature now that suggests that, and some schools have acted on this, that they let kids chew gum during exams because the process of chewing is actually helps them focus their mind. So it's interesting. There may be other elements to it beyond the digestive component. So it's
no
a
question.
curious comment.
Right. Yeah, no question.
Any other?
Yeah, I have a comment on that. you just got me thinking about it. It's something, this is Bob Coors, by the way. I bumped into Dr. Silverstein in Big Y last week, and he told me he was going to be delivering this talk today. And I said, well, I'll be there. And he said, well, you always are. So I would have come even if I wasn't a regular, but I'm glad I did. My comment is that my girlfriend and I often just sit and watch our dog gnawing away at an apparently tasteless thing that, we get in the pet store. And me being, sort of science minded, I've said to her, well, it probably releases some dopamine in his brain and some kind of wondering, but it's evolutionary, and you just got me to think that this bit about us chewing and then there's something there that is evolutionary, probably has all these physiological triggers that we may not have yet discovered, just like the gastrocolic reflex that I don't think I learned about in medical school, but now we know is a thing that, you, as soon as you start eating, I tell my patients who are constipated, I say, well, eat something and then, keep your eye on the clock. About 30 minutes later, go grab a magazine and sit on the toilet, because your body is kind of evolutionarily prepped to evacuate and make room for the new meal. It's just wired into us. So chewing must be wired in. And I know I eat too fast. I sometimes wonder, where did the food go? I forget, if you're not paying attention, you don't even know what's happening. I'd like to throw out two books or mention two books that you both probably know about. One is The 10 Talents, and the other is a series. I think it was a two-part series, Diet for a Small Planet. And then they came out with the revised version, which had to do with combining your protein sources, so that, say, cheese and nuts. I guess you're probably not that big on cheese, but thinking of combining proteins so you get the total complement of amino acids necessary for our bodies to then physiologically make our native proteins.
Francis Moore Lappé was one of the first books in the late 60s to put forward that complementary protein combination of grains and beans for full complements of amino acids. I interrupted, but both those books, Francis Moore's daughter wrote the second book, important for sure. There is in Chinese medicine something called the Qigong of chewing, and it's known as banging the heavenly drum in order to drink the heavenly nectar. And you literally chew for 30 seconds and then circulate your tongue around and then drink the saliva. And it's a health given practice in much of Tai Chi and Qigong practices that are regularly done. They've known about it a long time.
Fascinating.
Okay, so I don't see any questions in chat, and we're at 9 o'clock. I want to thank Dr. Spear for joining us as a guest, and Dr. Silverstein. Bob, please, always, if you have ideas for presenting, it's always very illuminating, provocative, and in a very Renaissance kind of way, which is why I'm delighted that you were able to give us our talk today. Thank you.
Thanks very much.
Thank you.
And happy holidays to all.
Hello.
Happy holidays to all, and specifically tonight is the first night of Hanukkah.
Very good.